Hello, my name is Dr. Liam Clay. Welcome to Embedding Equity in Behavioral Welfare, looking at council-led solutions for companion animal management. So today we're going to be looking at why this matters. So One Welfare focuses on human, animals, and the environment, and it is a key factor in behavioral welfare, creating fairness, opportunity. And it's not just about controlling the behavior within the community that we see with our dogs or cats. Councils are no longer just holding facilities for these government agencies or even adoption agencies. They are becoming adoption agencies themselves. So traditional role, they were normally short-term empowerment, compliance, and enforcement, whether that was dangerous dogs, barking, complaints, and all of that, especially with the rangers. And you had an animal facility that would hold these dogs and that would hold strays. But now we're looking at a different approach and how this can change with the paradigm. So current reality is that shelters and rescues are at capacity, and councils increase responsibility for rehoming directly. And I've had a few councils come to me that are looking at adopting out animals that they have, and because the shelters are backlogged and they can't get these animals out. So this shift creates both risk and opportunity for councils and government agencies. And it goes beyond stopping problematic behaviour or problem behaviours occurring within the local government areas. So it ensures every dog has a fair choice, and standardised procedures for councils to encompass the One Health model, and council influences shelters, rangers, and community education. Now, this links animal welfare to community wellbeing and creates sustainable solutions. So the challenge in the current system is that traditionally pounds focus on short-term holding and compliance. Today, rescue organisations are backlogged and councils are expected to adopt out dogs directly. Well, some aren't, and some are looking into it. So without structured behaviour framework, dogs are judged inconsistently, and even dangerous dogs are. Rehoming becomes risky and resource heavy for these councils and towns. Public trust in councils can become quickly eroded, and process for intake and assessment of dogs and dangerous dogs can vary state by state, council by council. And assessments vary widely between councils and the shelters. So they mainly rely on outdated and risk-only models. And dogs with no issues are backlogged in the system, and this can lead to unnecessary euthanasia and public frustration as well. And the lack of education and upskilling of rangers and animal care attendants within the councils has been seen in the last couple of years. So we need to lead a change and create a paradigm shift within this model. And we don't want to have high false positives and negatives in our assessment and our procedures. So behaviour as a social and ethical issue. So councils now sit in the front line of adoption decisions. Their evidence-based behaviour programs ensure dogs are not euthanized simply due to kennel stress or a lack of shelters that cannot take them, or rescue organisations. Families are matched with pets they can be successful with, and councils build credibility as humane, community-focused services rather than just compliance and enforcement. And this is no longer just about empowerment, it's about keeping pets and people together through the fair process that we need to create. So, inequality in current practices. So the outcome depends on which pound a dog enters. It's not just about its behaviour. Some councils rehome, others just euthanize simply based on their case or whether they're labelled as a dangerous dog. Vulnerable families are most likely to surrender pets or lose pets, and they become a stray. Inconsistent processes equals higher costs, reputable risk, and poor welfare. And inequality equals poorer welfare outcomes, weaker councils, and community relation. And that will decrease that relation as well. So why does it matter? It builds public trust in the animal services that we provide. It reduces unnecessary euthanasia and re-surrender. Provides staff and rangers with a clear framework that they need to maintain, and aligns with community expectations for humane and transparent outcomes. And it promotes a social responsibility through the One Welfare model. So introducing a One Welfare behaviour program. So when we look at a One Welfare behaviour program, It's inclusive and evidence-based program designed for councils, and it's structured, scalable, and replicable, and can be replicated over time. And it focuses on equity at every stage. So it incorporates the one health and one welfare model, and that looks at humans, animals, and the environment. And it reframes the idea of behaviour as part of health and welfare and not just a risk and enforcement. So the program framework overview is designed to support councils to move beyond holding and into rehoming with confidence. It integrates 3 pillars of dog-focused environment and their monitoring. It creates a structured process for assessment and adoption, or giving that assessment to the shelter organisation so they can just adopt out these animals when they are not backlogged. And it also upskills rangers and staff with clear competency pathways. All 3 must work together to be real and sustainable and have a flow-on effect. And this structured process allows a flow-on effect to these rescue organisations as well, which we'll talk about soon. So it's creating a fair intake process. So many dogs arrive as stray, abandoned, or seized with little to no background information, and that's okay. Structured intake protocols give every dog the same fair starting point, and even can incorporate those dangerous dogs as well. Early veterinary checks identify health issues that can mimic behaviour problems, and where history exists, if there is any, it is collected and added into the system. Then there's transparency intake notes, ensuring decisions are based on evidence and observation, not just assumption. And it starts from day one. Even if we know nothing about the dog, we can create a model and create a behaviour model of that individual and see whether they can be rehomed and go to a rescue organisation to be rehomed, instead of creating more risk for the community. So the in-kennel monitoring is a daily welfare monitoring tool. So dogs are more than a single just assessment. They want to look at data over time. So daily monitoring captures stress recovery and small improvements over time. It allows us to emotionally monitor how they're doing every day using a traffic light system. And it makes it accessible and easy for staff to use. And it builds a record of each dog's adaptability and welfare and positive and negative welfare over time. This data empowers fair decisions at adoption stage, or for rescue organisations to go, cool, we'll take that dog and we will adopt that dog out if you cannot. So it creates a structured behaviour assessment, and it replaces ad hoc or inconsistent testing styles. It looks at behaviour in context, fear versus aggression, arousal versus the risk, and recovery speeds after stress, and how they're dealing with stress over time, and whether they are emotionally regulated, and what kind of level they are, and whether there is appetite to go back into the community for that rehoming of that dog, or whether there is a high risk of that dog needing more behaviour therapy to fix that problem, and is it a risk that the councils should endeavour to do. And it focuses on potential management strategies, not just a pass-fail technique. We create decision-making matrices for councils to follow, and creates a standardisation in dogs that are rehomed. And it also identifies in the matrix medical and behaviour risks with higher level dogs. And it provides councils with defensible and transparent outcomes so that it can be maintained to be more efficient and effective. And then there's that empoweredness within the councils to make and create those outcomes, whether positive or negative. So adoption pathways and community support. So many council dogs arrive as stray or seized animals. No full histories are there and are not available. Behaviour-informed profiles can be created to create transparent evidence-based information. Families receive realistic expectations, what behaviours are, and what that information is. And it's a structured post-adoption support if that council wants to. And it's a follow-up call, resources, and referral to community classes. It's a community case a community case model that can be created and effectively replicated over time. And there's transparency between the adopter and all the information that they are receiving. This turns uncertainty into confidence and adoption into a support journey. And there's a relationship not just with the council itself, but the council of the adoption agency and the individual that is getting the dog. So it also upskills rangers and staff, a critical element. The program invests in people as much as dogs. It tailors training modules, recognizing stress, monitoring behavior, and engaging adopters, competency pathways so that we can upskill rangers and staff from basic to advanced levels. There's professionalism in the rangers rather than having positive and negative effects of rangers and them identifying dangerous dogs. And building staff confidence reduces burnout and strengthens council's credibility. It also allows us to do annual reviews and continuous educations for the councils. This ensures that the tools and processes stay evidence-based. Staff feedback drives program refinement. It can continuous professional development. It keeps those rangers and council people updated with the most up-to-date information. It creates a long-term sustainability model. The benefits to councils are reduced euthanasias of those dogs and a fair monitoring assessment tool. It creates transparency, defensibility, and decision-making, and reduces compliance and appeals. You also have people, which rangers and staff are empowered with skills, less reliance on external rescues, and better relationship with those external rescues. So the benefits to the dog, it's humane, consistent decision-making at every stage. It allows monitoring and an increased welfare standard within council pounds or council animal welfare facilities. And they're not just judged based on ad hoc information or subjective information. This can be a structured adoption support and higher rehoming success, not just for the councils, but also the rescue organisations. So that takes that responsibility on. It reduces kennel stress and improves welfare during that stay. So the benefits for the staff and rangers, there's clear structured guidelines, and reduces stress and uncertainty. There's competency pathways if those rangers choose or want to do that. There's a staff shift from being enforcers to being welfare advocates, and reduces emotional fatigue and moral injury by embedding fairness into the process. The benefits for the community itself, consistency and transparency built in trust in council animal services, a family supported to keep pets, not just surrender them, or they get out and there's a enforcement or reprimand for that. Behaviour informed adoption, making adopters feel prepared and stronger in human-animal bonds, contributing to healthy communities. And they can be the forefront of that education. Now, the example of a council pilot program can be based on the 3 pillars of monitoring, structured assessment, and staff training. The outcomes of it is surrenders reduce significantly, adoption success rates improve, and rangers report higher job satisfaction, and community feedback praise fairness and transparency. Critical impact here is dogs are assessed and prepared in council facilities can then be moved on to rescue organisations with a full profile. Reduces backlog by providing adoption-ready dogs instead of passing on unknown ones, and rescue organisations can focus on resources on high needs and complex cases if they want to. This creates a true partnership with councils, rescues, and communities of all benefits. Now, it supports rescues and shelters. Now, councils are not in competition with rescues, they are partners in the same system, in the same model. By using structured monitoring and behaviour assessments, councils can improve transparency information, which is then transferred from dogs to the rescue organisations, move on dogs who are adoption ready, freeing rescues to focus on high need cases that they want to, and reduce rescue backlog, prevent them from being stuck with long-term cases that they cannot deal with. This ensures smoother handover, stronger partnerships, and better outcomes for dogs and adopters. So, as I said, there's 3 pillars to this. There's the dog pillar, process pillar, and people pillar. So dog is just daily monitoring and welfare. The process pillar is structured intake, assessments, and adoption pathways. And the people pillar is a structured, scalable, and sustainable upskilling of staff and competencies. The key takeaways from this is councils are now the front line of adoptions as shelters reach their capacity. Equity must guide behaviour decisions to ensure fairness and safety. And the 3 pillars of the behaviour program builds capacity for long-term change and a powerful shift. The benefits are for both dog staff, council, rescue organisations, and all communities. Equity is not an add-on, it's the foundation of effective animal welfare. So just to finish up, it's a call to action right now for councils already rehoming or considering it, adoption of evidence-based framework to avoid inconsistent outcomes, investment in staff capabilities and training, embed equity in policies, processes, adoption pathways, and partner with rescues, vets, and communities for shared success. Thank you.